Doctor has asked for me to perform a skin scraping today. This is for a suspected fungal infection. What this involves me doing is preparing the skin with some alcohol to eliminate any bacterial overgrowth, then using a small blade to scrape the loose skin into a petri dish. The first thing I'm going to do is just clean the area with a bit of alcohol. This is to eliminate any bacterial overgrowth. I'll then let it air dry. Once the area is dry, I'm going to use a small blade to remove the loose skin into a petri dish. You should be able to hear a light grazing sound as you're performing this. Just hold the blade on a 45-degree angle, remembering that the blade is very sharp, not to injure your patient. The skin scraping could take up to 10-15 minutes. After a few minutes of scraping, you should be able to see some evidence in the petri dish. It's also important to place the blade in the dish as well, because there could be some particles on there. Once the procedure is finished, you can then seal the petri dish up, and we place some micropore around the sides. We use micropore because it is porous and allows the sample to breathe, preventing sweating. We then label the sample as we do every other sample, with the patient's surname, first name, date of birth, and lab number. It is also important to put the date on this sample and where the sample has come from. So in this instance, it was the patient's right arm. If I feel the yield was insufficient, I would then use a trans swab to try and obtain some more cells. I'll do this by wetting the swab in the culture gel and then rolling it across the patient's skin. Labelling the tube with the relevant information as well as the site which you've collected it from, so the right arm. This accompanies the petri dish to the laboratory for testing.